Would you believe that some of the medical tests your doctor recommends for your own good could actually increase your risk of stroke overnight? Every year, millions of older adults go through routine checkups, trusting that these tests will keep them safe. But what few people realize is that certain common medical exams can quietly strain your heart, constrict your blood vessels, and even reduce blood flow to the brain. In today's video, we'll uncover the truth behind 5 popular medical tests that may secretly raise your stroke risk after age 60, and, more importantly, how you can protect yourself before it's too late. Part 1. The hidden side of routine checkups. Every year, millions of seniors walk into clinics believing that regular checkups are the best way to prevent disease. We trust our doctors, follow instructions, and feel relieved when the results come back normal. But beneath that reassuring surface, there are silent risks that almost no one talks about. Not in hospital brochures, not in the media, and sometimes not even from the doctors themselves. Imagine this: you finish your annual health exam, everything looks perfect. 2 days later, you feel dizzy, your vision blurs, you can't speak clearly, or your arm suddenly feels weak. A mild stroke has struck, out of nowhere. The truth is, certain diagnostic tests, especially when done too often or in fragile health conditions, can disrupt blood pressure, affect circulation, and trigger dangerous responses in the brain's arteries. The point isn't to fear medicine. It's to be aware and stay in control. Because after 60, good health isn't only about finding diseases early, it's about avoiding harm where you least expect it. Part 2. 5 common tests that may raise stroke risk. 1. CT scan with contrast. Dye. You might have felt that warm flush when contrast dye enters your veins. But for older adults, especially those with heart disease, hypertension, or kidney issues, this dye can cause sudden blood pressure spikes or drops. Some people feel dizzy or faint. Others experience extreme pressure that can constrict blood flow to the brain. A study in the Journal of Vascular and Interventional Radiology found that older patients who underwent CT scans with contrast had higher vascular complications within 72 hours. In one real case, an 81-year-old man had a CT just to be safe and suffered a mild stroke 2 days later. Tip: before agreeing to a CT with contrast, ask, is this absolutely necessary? Can it be done without contrast? That simple question could save you from a serious complication. 2. Cardiac stress test. This test measures how your heart performs under physical strain, but after 60, pushing the heart too hard can be risky. During stress testing, the heart rate and blood pressure rise sharply, and in fragile arteries, that's like testing an old engine at full throttle. Research from 2020 revealed that about 7% of patients over 65 experienced complications during or shortly after the stress test. One 74-year-old woman in Ohio suffered a minor stroke immediately after a treadmill test due to a sudden blood pressure surge. Tip: if you have no chest pain or shortness of breath, ask your doctor if a resting echocardiogram or a nuclear stress test might be safer alternatives. 3. Endoscopy or colonoscopy with anesthesia. Endoscopy is common, but when combined with anesthesia and blood-thinning medication, it can become risky for older adults. Anesthesia can temporarily drop blood pressure, while thinner blood may reduce oxygen flow to the brain. A 2021 study found that seniors are more likely to experience silent strokes within 72 hours of undergoing these procedures. Tip: if your doctor suggests an endoscopy just for routine screening, ask, is it truly necessary right now? If there are no symptoms, a non-sedated endoscopy may be a safer option. 4. MRI with gadolinium contrast. Gadolinium, the metal used in MRI contrast, is filtered by your kidneys. But in people over 60, especially those with reduced kidney function, this metal can accumulate in the body and even the brain, leading to fatigue, confusion, or imbalance. In one case, a 79-year-old man went for a simple MRI for back pain and spent the next week feeling disoriented, later found to have early kidney disease. Tip: always check kidney function, GFR. before an MRI with contrast, and ask if a non-contrast MRI could provide similar information. 5. Carotid ultrasound, neck artery scan. This test looks for blockages in the neck arteries that supply the brain. While it's safe in itself, the results can sometimes lead to unnecessary surgery, especially if mild narrowing is found. For seniors with no symptoms, surgery may not reduce stroke risk, and can even trigger one during the operation. According to the New England Journal of Medicine, in asymptomatic patients, medication and lifestyle changes work almost as well as surgery. Tip: if you're told you have 50–60% blockage, ask, what happens next? Do I really need surgery? Getting a second opinion is often the best decision you can make. Part 3. The wisdom to protect yourself. Not all tests are bad, but not every test is necessary. After 60, our bodies become more sensitive. A single injection, a small dose of dye, or a brief drop in blood pressure can cause a ripple effect throughout the body. So always remember to ask, is this test truly necessary for me? Are there safer options? Knowledge is the strongest medicine, because good health isn't about fearing doctors. It's about understanding your body, asking questions, and choosing wisely. If you've ever experienced side effects after a test, type 1 in the comments. If you haven't, type 0, and share this video to help others stay informed. And don't forget to subscribe to Timeless Wisdom, where we learn how to stay healthy, stay mindful, and stay wise through every season of life.